I just wanted to say, first of all, real quick, my background, I worked in the VA healthcare administration for 24 years as a medical psychiatric social worker. And even though nothing's perfect, I am very happy with the care that the veterans got. The whole time I was there, excellent surgical care. I would hate to think of what would happen if our veterans had to wander around and show up at ERs here and there. So I just want to make that comment. Then my question really is now, having watched Townhalls on TV, having, a little bit of, everybody has a right to express their feeling, and I think this Townhall has been very, on the whole, very polite. I see a lot of fear and negativity. And so my question is, where do we go from here? How are we going to deal with that? Since a lot of what's going around may or may not be, and whatever bill ends up coming out of the whole negotiation, where do we go from here? I mean, what you're showing us is a bill that came out of your committee. So that's my concern.
Well, the drama is not yet written. I don't know the end of this drama. I think that America has always been a country that moves forward. It's one of our great geniuses. We have moved forward with the Emancipation Proclamation. We moved forward with the Civil Rights Act. We moved forward with Medicare. We moved forward because of some work that Senator Kennedy did that now allowed disabled people to get a wage. We've always moved forward. We've always been a country that I think over the long run has chosen to embrace our hopes and surmount our real and legitimate fears. And change is always a contest between hope and fear. I am hopeful, and I believe we were likely to be successful to find a consensus that a majority of the House and Senate, the Vice President, will sign something that will improve our health care reform. I believe that we will achieve that. That is my belief on a more likely than not basis. There's a lot of work to be done. There's a lot of work to be done between now and then, and I can tell you you're all helping us, and I appreciate it.
Thank you for answering your emails. I'm a little worried that a 1,000-page bill is going to be almost impossible to actually manage. And I'm afraid nobody actually knows what it says. This sort of feels to me like a legal quagmire, just a gigantic pile of bureaucracy that nobody's going to be able to live through. That's what I'm worried about.
You're all going to die. You're all going to die. Be afraid. Be very afraid.
1,000 pages, please.
Well, you're correct. It's 1,000 pages. I've read them all, and I can tell you on page, I think it's 430, I think it's 447, line 9. There's a typo. It says states. It should say states plural. Okay, so I can tell you at least one error. I'll just tell you, I think the challenges are surmountable. I believe I'm in a position, and my colleagues, both who are for the bill and who are against the bill, are in a good position to evaluate the pros and cons of these issues. I think you would be impressed, both for those who favor the reform and those who oppose the reform, of their understanding and the ramifications of this bill. The debate we had in the Commerce Committee was about a 40 or 60-hour markup. We went through it line by line. We have spent days and days and days evaluating the bill. I understand the legitimate concern about something this complex, but we are the people who went to the moon, and I can tell you the Apollo project had more parts to it than this bill. And so I think we've done some pretty bold things in this country. The rest of the industrialized world has managed to make some progress. I think America's capable of moving forward.
First of all, I'd like to say that I think everybody that's in the room is for health care reform, so I don't think there's a question of whether we're for health care reform. Right now, our government seems to be in a financial crisis. We're all aware of it. Here it is. We have a lot of zeros behind our deficit, and it's growing. And in the last year, as an American citizen, I've just seen congressmen spending money like, well, I would say drunken sailors, but it's not fair to the sailors. That's not a partisan issue. It's a political issue, and I see it. So I'm not picking on Democrats, and I'm not picking on Republicans. That's my commentary. Another comment, I'm not part of anybody's astroturf either. So having said that, here's the actual question. It's basic. In this atmosphere, in this climate of financial crisis, trillions of dollars of deficit we have, what is our confidence in the government estimates of both savings and spending? They've been wrong over and over and over and over.
You know, you are totally accurate. I have been one who has been concerned about the federal deficit for a long time. And I can tell you that you are totally accurate that the U.S. government has been wrong on its predictions of costs. When Paul Wolfowitz and George Bush told us to do